Hey everyone! So today we're going to talk about something that pretty much every cat owner has wondered about at some point, drooling. You know, sometimes it's kind of cute, sometimes it's a little messy, but every now and then it can actually be a sign that we need to pay a bit more attention.
You know the scene, right? Your cat is happily curled up on your lap, purring up a storm, maybe doing that little kneading thing with their paws, and when they finally decide to get up, you find a nice little wet spot on your shirt. Is that just pure blissful happiness, or could it be a sign of something else? Well, that's exactly what we're going to get to the bottom of.
All right, let's break this down. First things first, some drooling is totally 100% normal. It usually goes all the way back to when they were kittens. See, when kittens are nursing, they need to get the milk flowing, and that creates this super powerful comforting memory. So when your adult cat is just incredibly relaxed and content, that same kneading and purring can actually trigger a little bit of drool. The real key is to watch for a change. If the drooling is suddenly happening all the time, or if it shows up with other symptoms, that's when our ears should perk up.
Now, there's a fancy medical term for this, Ptyalism, or the easier one, hypersalivation. All it really means is that there's an excessive flow of saliva. I like to think of it like a leaky faucet. You know, is it just a few happy little drips when they're purring, or has it turned into a constant, unexplained drip that tells you something just isn't quite right? That's really the main difference we're looking for.
So how in the world do we tell the difference between that normal, happy drip and something that might actually be a problem? Well, to do that, we first have to understand what could be causing it. So when we're talking about excessive drooling, the list of possible causes can look a little long, maybe even a little intimidating. But don't worry, they really fall into just a few main categories. And we're going to start with the most common one.
Okay, so the number one reason, far and away, is usually an issue inside the mouth itself. I mean, think about it. Anything that's causing pain or discomfort in there is going to ramp up saliva production. This could be anything from gum disease to a chipped tooth to painful ulcers. Sometimes it's even something stuck in there, like a piece of string wrapped around their tongue. And yes, unfortunately, oral tumors can be a cause too. The main takeaway here is pain in the mouth very often leads to drool.
And just to give you some perspective on this, get ready for this number. Up to 80% of cats over the age of 3 have some form of dental disease. 80%. That is a huge, huge number. And it really shows you why checking the mouth is almost always the first step when we see a cat with unexplained drooling. It's just that common.
But, of course, it isn't always a dental problem. Sometimes that drool is a clue that something's going on elsewhere in the body. Nausea is a really big one. If a cat feels sick to its stomach, whether that's from kidney disease, liver problems, or just GI upset, they will often start to drool. Another major trigger is ingesting something toxic, like certain houseplants or cleaning chemicals. Even something like a bad cold, an upper respiratory infection that makes it hard to breathe, can lead to more drooling.
And then you've got this whole other bucket of triggers that aren't necessarily about a disease. We've all seen it. That dreaded car ride to the vet. Extreme stress or fear can absolutely cause a cat to drool. It can also just be a reaction to something that tastes really awful, like a bitter medication. And of course, especially on hot days, we have to think about heat stroke, where drooling is a very serious warning sign.
Now, this is where you come in. As the owner, you are the most important detective in this whole process. The drool is a big clue, for sure, but it's often all the other little signs that help us put the puzzle together.
So, besides the drool itself, what else should you be on the lookout for? What are those other puzzle pieces we need? Okay, here are the big ones to watch for. Is that drool coming with some seriously bad breath? Have you noticed them pawing at their mouth like something's really bugging them? Maybe they seem interested in food but then back away, or they're dropping it when they try to eat. Other signs can be a bit more subtle, like just hiding more than usual, or they can be more obvious, like vomiting. And for sure, any blood in the saliva or any swelling around their face, those are immediate red flags. Just making a mental note of these things is so helpful for your vet.
All right, so you've noticed some of these signs and you're concerned. What's next? Let's quickly walk through what a vet visit for drooling usually looks like, just so you know what to expect. No surprises.
It's a pretty straightforward process. First, we're just going to talk. Your observations are pure gold. They're the starting point for everything. After that comes a good, thorough physical exam, paying special attention to the mouth. Now, sometimes this might require a little sedation if it's painful for them. Then, depending on what we see, we might suggest some tests, like blood work to check their organs, or x-rays to see what's happening below the gum line. And all of that information helps us get to the final step, creating a treatment plan that's made just for your cat and its specific cause of the drooling.
And here's the really good news. Once we figure out why it's happening, there are a lot of clear paths we can take to get your cat feeling so much better. the outlook is usually really positive.
It makes sense, right? The treatment is going to match the cause. It's never a one-size-fits-all thing. If it's a dental problem, a professional cleaning, maybe even removing a bad tooth could be the answer. If there's an infection, we'll use targeted medications like antibiotics or pain relief. Sometimes it's as simple as getting a foreign object out of there or just making a change to their diet. And for those other issues, like stress or a systemic illness, we focus on management plans and supportive care to keep them comfortable.
So, as we start to wrap things up, I want to leave you with the single most important message from all of this.
If you remember one thing today, please let it be this. You know your cat better than anyone on this planet. A sudden, new, unexplained change in their drooling is not something to just brush off. It's their way of talking to you, of telling you that maybe it's time for a checkup. Always trust your gut. And finally, a quick but important reminder. This information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.